Hi there, welcome very much. Thank you very much for joining. Welcome to the webinar. We're just going to start in about 1 minute's time, just to give a lot of people the chance to join. Okay, so I think we'll make a start. Divine, you'd let me know if there's any technical problems, but we'll make a start. So thank you so much for joining. It's a real pleasure to have the opportunity to discuss with you all a topic very close to my heart, which is RSV, and how we can prevent serious illness in babies from this virus. So I think we've got a big audience today. So thanks so much for joining this Lunch and Learn. As I understand, we've got a combination of families, doctors, nurses, non-clinical staff, people from really a range of backgrounds. And this talk is hopefully going to meet all of your needs. So I'll talk for just under half an hour, and then there'll be some time for questions. So thanks again for joining. So who am I? So I'm a pediatrician by trade, and I am doing some research with the Born and Bred in Baby Network. That's also connected to the UK Health Security Agency, which is the National Public Health Agency, as well as the University of Oxford. And this is the number one of all the vaccine recipients, in my opinion. This is my lovely baby son who was born during the very first national vaccine season this winter. So I'm really excited that we've got vaccines now available, and he was born at a very lucky time. So I think that you can put things into the chat. Divine, tell me if you can't, but it'd be great to hear a bit more about you. We won't have time to read them out, but if you are up for it, please, in the chat, please put your name, what brought you to this talk, and if you are working, please let us know what you're up to. And yes, if you put those in now, we'll have a little read through it as we go. And if you can't make the chat work, then feel free to put it in the Q's and A's for now, which I think should be enabled. And Divine, maybe you can try and make the chat work if it's not working for some people. So yeah, thanks very much for joining. I've just put a little QR code here, which is about some of the baby studies that are happening. If anyone's interested, feel free to scan that. There'll be more opportunities to scan it if you don't get the chance. So we're going to talk a bit about what RSV is. We're going to talk why and what has been introduced in terms of vaccinations. We're going to talk a bit about some of the research in RSV that's going on, and then I would love to hear your views on research, and we'll have the scope to do that. So I can see lots of great, lots of really, range of people already. That's great. Student midwives, people keen to further their knowledge. So thanks so much for coming. Really, really great to have you. So what is RSV? So RSV is a virus. It's very common. It comes around every winter, and it causes often very mild illnesses, but it can cause quite serious lung infections. Now, particularly this can be a problem for babies and very older people, and it can make it hard to breathe, it can make it hard to feed, and it can cause fevers. So for most people, this is a mild illness that can be managed at home, but quite often babies end up needing to be admitted to hospital or even intensive care because of this virus. It's far more common in babies that are born prematurely and in babies with heart conditions. So I'm really just focusing on babies for this presentation, but there is a whole other area of work which is about older adults, which we're not going to go into. There's this great website here called Stories of Parents by Rescue. Feel free to Google that. That is an amazing website where parents of babies that have had RSV share their stories, and it's really great. So just a bit about numbers. There's around 33 million infections a year caused by RSV in the world. That's a huge amount. There are over 3 million admissions every year, and there's over 100,000 deaths. So that means since I graduated from medical school, there's over 1 million deaths from this one virus in under 5-year-olds. And I just think that's absolutely astonishing. And whatever we can do to stop that, we absolutely must. In the UK, it causes around 500,000 GP consultations every year, and it costs the UK around 80 million each year for under fives alone. So I'm going to tell you a story. This is a story about a baby who we're going to call Aisha. And it's a very familiar story to anyone that's worked in clinical pediatrics. So this is a parent, this is their first time parents for summer last year, and it's a low risk pregnancy. This is based on a real case. They were expecting a straightforward birth, but unfortunately, the mum found herself going into premature labor around 33 weeks gestation. The baby was born pretty small at 1.8 kilos, and shortly after birth was having difficulty with breathing and ended up needing some resuscitation and breathing support. They ended up on a ventilator, having antibiotics, and are staying on the intensive care. They spent nearly a month there, and this was a very difficult time for them, a hugely difficult time for them. But over that month, the baby got better, learned how to feed, and went home. And they were totally delighted, but felt very unprepared for the next steps. So a couple of weeks later, their baby Aisha starts to get a bit sniffly, and after 3 days, really starts to have real serious issues with feeding and can't breathe properly. So they take her to A&E. At this point, her oxygen levels are found to be low. She ends up on high flow oxygen therapy. She needs a feeding tube, and she's admitted to the hospital. The next day, she's starting to look really tired with this illness, and suddenly she stops breathing. So, a huge emergency. Everyone rushes in, ends up needing to be ventilated again on a ventilator and transferred to the intensive care. So, I'm really glad to say that Aisha is totally fine now, and she went home and she's absolutely well, growing, feeding. But it's a really difficult time for the parents, and they're very anxious about the future. And this is an exceptionally common story, and every single person that's worked in pediatrics will have an experience like this, and it's very difficult for everyone involved. So the big question is, can that be prevented? Could that lung infection have been prevented? And I'm really excited to say that we're now in an era where the answer to that question is yes. So I'll talk a bit more about that. So there's two main options that we think about when we talk about preventing a serious burden from RSV disease. And the first one is maternal vaccines. So maternal vaccines is a vaccine that's given to mum. Immunity boosts as a response to that vaccine. And the main mechanism by which protection is conferred is through antibodies. So mum generates antibodies, and then she passes these through the placenta, particularly IgG antibody. And this is an amazing antibody, and it lasts for at least 6 months, provides protection. So this has been trialed in large randomized trials. And this is the Campman trial for anyone that wants to Google a bit more and find out a bit more. And so this is the evidence from the trial. So they did this large randomized control trial where you have half the women getting vaccine, half the women getting a placebo. And then over the first 180 days of life, they look at how many babies get a lung infection needing to go to hospital, and how many babies don't. So on the bottom is the time. On the left is the percentage of children that need to go to hospital because of an RSV infection. And you don't need to know all the details here, but basically the yellow line here is the ones that receive the vaccine, and the blue line is the people that receive the placebo. And as you can see, in the people that didn't get the vaccine, there was a higher amount of children needing to go to hospital due to RSV infection. And when you calculate the numbers, that works out as around 80% effectiveness, which is pretty good for a vaccine, and that's within 90 days of life. So that's the main option for most women and families that's number one, maternal vaccines. And option number two is infant injections. So there was another injection before, which I'm not going to go into in too much detail because it's a very small number of infants that got it. But the kind of main new kid on the block is this thing called nirsevimab, which many of you might have heard of. Bradford was involved in the clinical trial, which tested it to see if it worked. And this is available for certain infants in the UK only. And this was only introduced very recently. And those include babies that have got heart problems, severe immune problems, chronic lung problems, and extremely premature. And the reason it's restricted to such a kind of narrow group of individuals is really because it's so expensive. But the injection is a good one, and it provides protection for at least 6 months that we're aware of. So the Harmony trial was the name of the big research trial which Bradford was involved in. And what they found is they this is a figure which is sort of the opposite of the one from the one before. So now it's the number of kids who didn't end up being having to see a doctor with an RSV infection. And the bottom again is time, and on the left is the proportion of children that didn't need to see a doctor due to an RSV infection. And the yellow line is those that received this nirsevimab injection, and the blue line is those that didn't. So as you can see, those that had the nirsevimab injection had really good protection and didn't need to see a doctor as much. And this was, similarly nearly around 80% effective in preventing severe infection in infants within 150 days. So those of you that are really astute will see that they're not exactly the same outcomes and they're not exactly the same time points, which is quite common in research. But the bottom line is they're both great immunizations for preventing disease in babies. So what's going on in the UK? So following this really amazing trials that happened in the last couple of years, we found that there is a really good couple of immunization approaches. And because of the huge burden of illness in the UK introduced a program in September 2024. That's last winter gone. So all pregnant women are offered a RSV vaccine from 28 weeks gestation. Some of you might have seen this leaflet, and it's offered either via the midwife or via the GP. And as of this winter, there's been a kind of expansion to the program. So babies that are particularly vulnerable are offered this monoclonal antibody nirsevimab. And that's for kind of a range of infants born under 32 weeks gestation. And that's replaced a program and expanded a program that was in place called palivizumab, which I'm not going to go into. So what's happened so far? So for first season, it's not too bad. Pretty good. So we've had around 53% of women nationally, pregnant women nationally, have had the vaccine, which is pretty good for a first season, but definitely room for improvement. And what you can see is there's quite a lot of inequalities in how people are accessing that vaccine. So in the southeast, there's over 60%, whereas in the Midlands and in London, it's between 40 and 50%, and Yorkshire somewhere in the middle. But there's a lot of regionality within Yorkshire. And then there's quite a big differential in terms of different groups, women from different ethnic groups, and how they're taking the vaccine. And Black British and Asian British families have got a really low uptake. So, 32, 33% compared to white British and white Chinese, and Chinese families who's, over 60%. So there's a huge piece of work to understand why there's such a difference and what we can do about it to improve the offer for all women. What about the rest of the world? So it's a very exciting time. This has all happened in the last couple of years in terms of rollout, and the UK is one of the first countries to have a program. The UK was the second country to introduce a national RSV maternal vaccine program, but America introduced a hybrid program before us. And there's around 10 countries internationally, or at least there was when I last did the research, but it's ever growing. And so, yeah, it's a new era, it's a new time, and everyone that's working in this field is very excited to see what's going to happen. What about Bradford, and what about the areas around Bradford? So now we're transitioning into research. So I'm a researcher as well as a pediatrician, and I'm going to highlight some of the research that's happening predominantly through my work and through the work that's happening within the BaBi network focusing on RSV. So one thing that we did is we did a national survey, including women in Yorkshire, but also nationally. And we asked women who had signed up to the Bounty app, which is a pregnancy app. And we had 1,000 women reply. And we asked them, how much do you trust the following for your information? And there's a lot of midwives on this talk. I'm glad to say you guys are number one. You're better than doctors. We probably all knew that, but it's good to see it in black and white, or green and red. So midwives were the most trusted. So this green line here is whether you completely trust or mostly trust. Gray is neutral, yellow is a little bit, and red is not at all. So midwives were, over 80% trusted. That's great. Doctors somewhere in the middle, and social media, lifestyle websites, and the TV were least trusted, and the government pretty low. So take what you will from that. We also asked whether people would like the idea of accepting the vaccine. So we weren't giving them the vaccine. We just said, if you offer the vaccine, do you think it's right? Do you think it's acceptable? How likely would you be to accept it if you were just offered the vaccine now? These were pregnant women, and a huge amount said that they were likely to accept the maternal vaccine. So if you're paying attention to the earlier slides, you'd have seen that this is much higher than the amount that took the vaccine. There's probably a few reasons for that. There's probably some problems with how we asked people and what we did as a study, but I think this is also a true effect, which is that there's more people keen on the vaccine than are getting the vaccine. And I think there's a big question about why that's happening. And it might be because the vaccine's hard to get. It might be that something happens in their appointment and they're focused on something else. It might be that they can't afford to get to the clinic. There's a lot of reasons that might be. And there's a big piece of work to understand why the vaccine rates are low, or not low, but could be higher. But I think the takeaway from this is that the vaccines are largely acceptable, not 100%, but pretty acceptable. And we do need to think a bit about how we can improve the offer to make it acceptable to the most women possible. So this is a piece of work that I wasn't involved in, but it's Pia Hardler's group, and they conducted work within Bradford and within the BaBi network, and they looked at antibody levels for babies. And this is nothing to do with the vaccine. This is just antibody levels before the vaccine program came in. And they found that this is a forest plot. And if you look at the bottom line here, where this grey line is in the middle, that means the antibody levels were exactly the same. If it's to the right of the grey line, it means they were higher. And if it's to the left of the grey line, it's lower. And the blue line is something called a confidence interval, which means if it's crossing that grey line, if the blue line is crossing the grey line, you can't really say anything. But if it's not, then that sort of implies that it's a significant difference. And then they've got different gestational groups here. So what they found was that babies born below 35 weeks had roughly 30% lower antibodies than babies born at term, and babies born after term had higher antibodies. We don't really know what that means. It's just one type of antibody they looked at. But I think it's an interesting signal, and I think it's something we need to think about more. I think we need to understand, does it matter having 30% lower antibody levels? Is this effect that keeps going down if you did more premature babies? Is that level of antibody enough? Maybe it doesn't matter if you've got slightly lower antibodies, but that's an area that we're actively interested in and want to do some more work on. If you haven't heard it, there is an amazing presentation by colleagues who might be on this call, which is on the BBC, and it's a podcast focusing on the new RSV vaccine and what's going on in Bradford. And I really do recommend listening to it. It's fantastic, and it's got the voices of lots of women whose children have had infections, and it's a really moving, good podcast to listen to. So this is just one more slide. So thanks those that were on the call that might have helped with this. This is just looking at the maternity uptake for this last season in Bradford. So this is looking at, in Bradford Hospital, what proportion of women from different deprivation groups have had the vaccine or not had the vaccine. So there's a lot of limitations to this. It doesn't look at GP data. It's only the first season, etc. But I think it's an interesting story to look at, and we're going to do some deeper dives into this in the near future. So on the left is percent vaccinated, and at the bottom is what kind of quintile of deprivation you sort of live in based on your postcode. So quintile on the far left is you're in a postcode that's very deprived, and quintile on the right is that you're in a postcode that's less deprived. And I think we can see first of all that the Bradford maternal vaccine rates are probably lower than is going on in general. So it seems that it's probably quite a lot of vaccines happening in GP clinics. But we might expect this to be a bit higher. We might want it to be a bit higher. But I think also there's quite a striking difference between the different deprivation quintiles. So if you're born in an area that's if you're living in an area that's more deprived, you might be around 70. It might be about 17% of women are getting the vaccine in maternity services, at least, compared to between 28 and 41. So that's a pretty striking difference. And I think we need to think about why that is. So this is an area of active interest, a lot of research going on, and just to say we're doing more research across this area, and we're hoping to do lots more. And we'd also love your views on that research. So we are doing some collaborative studies across Yorkshire that I'm involved in with Oxford and the UK today, and we're trying to develop a big real-world data set to understand maternal vaccines and what's happening in the real world and how they've been rolled out. And really, our big aim is to understand how best to protect against RSV and how to, stop this from happening in the children in the Yorkshire area. We're particularly interested in who isn't getting the vaccine, what's working to help that, how much they're working, particularly in premature infants. Does it matter when you give the vaccine? Does it make a difference? If you give it earlier in pregnancy or later in pregnancy, and is the nirsevimab program for the high risk groups working? Does it need to go further than it's going? So this is just a bit of a plug now, but many of you will be midwives or will be mothers, and we're starting this new study in 2 weeks' time, and we'd love you to get engaged with it. We're looking at recruiting mothers and infants who are part of the baby study overall, and if not, we'll recruit them to the baby study, and we're really looking in a deep dive on the RSV. And we're trying to use both routine data linkage for a big cohort, but also a more in-depth immune cohort that are going to get some nose swabs and some blood tests. And this will really help us to understand how we can maximize and provide the best protection to the most infants. So this is the information sheet. Sorry for the shameless plug, but I'm just going to talk a bit about it. And we're inviting pregnant women across the area to help us look into how to protect babies against RSV. And the two main parts to the study will be that around the time of birth, we'll try and take a blood test from the baby, and this will hopefully be as much as possible a blood test from the umbilical cord, so doesn't involve any pricking of the baby, but very occasionally we think it might involve a blood test from the baby and a nose swab, and then a nose swab and a blood test from mum, and then again one at 6 months from the baby. And this will also be accompanied by a questionnaire. And we really think that this will help us to understand much more about how to provide the protection to the most babies, which we're really passionate about. So if you're interested, there's the email address. And we'll also have a QR code in a minute that you can scan. So that is not the QR code, but Divine, do you mind sharing the link to the RSV Baby Network? Sorry, just the Baby Network study in general, and then you can read a bit more about it there. But we're also really keen to hear about your views on RSV vaccine research and RSV immunization research. And we'd love to hear your views in the chat and/or on this survey here. So if you've got phones, feel free to scan that code. But essentially, the main questions that we'd love to hear your views on is, what do you think would help make immunization offers better during pregnancy, particularly thinking about families at higher risk? How can we make it more accessible, more acceptable? And second of all, how can we make it more appealing for families to take part in research and cohort studies? And there's some other questions there as well. So if you are happy to, please go on that QR and fill in the feedback. And Divine is also going to post a link, if you don't mind, for the feedback there. And we'd just love to hear what you think about this area and what we should be doing. So thank you. So a big thanks. This is a lot of ongoing active work. And we're really grateful to all the people here and many more who have contributed to this area of work. And obviously a huge thanks to you for coming, for being interested in RSV, how we can protect babies. And this one, if I've got it right, is the same QR code. So if you didn't get a chance to scan it a minute ago, then feel free to scan it now. There's my email. Do get in touch if you have any questions. There's the Bonn and Bradford email. So that we'll be running the study through that email address. So do link up. So thank you so much. It's been a real pleasure to have the chance to talk about RSV with you. And now would love some questions. So feel free to put them in the Q&A. Thank you.
Oh, lovely. Thank you so much. So we just got a few questions in the chat. So if you want to ask any more questions, please pop it in the Q&A. So first question, is it possible to have a copy of these slides?
Yep,
Dr.
we'll
Brock?
send them. Yeah, that's fine. Yeah.
And then from Amanda Waterton, she's asking why is it from 28/40, not 16/40?
Amanda, this is a topic that I'm very passionate about. I personally believe it should be 16/40. And I think that we will generate evidence from our study that will help to hopefully answer that question. When the pertussis vaccine was introduced, it was introduced a similar kind of time, 30 weeks gestation roughly. And we saw that, it's pretty good when we first rolled it out, but the uptake wasn't as good as it could be, and the protection particularly for premature babies wasn't as good as it could be. And I think often when you're introducing a new program, there is some hesitance and you want to introduce it a bit later, just in case there's any side effects or anything like that. But there's ongoing safety analysis. The vaccine is shown to be safe. So I personally think that there's a really good argument to moving it earlier anyway, but we're also hoping to answer that question with some of the studies that we're doing. And we're going to look at how well the antibodies are transferred based on when the vaccine was given. So I think that will hopefully answer that question a bit. And if we do find that the vaccine is better the earlier you give it, then, and we also find that it's safe, then I think it's a no-brainer to move it earlier. So thanks, Amanda. We'll quote you in the acknowledgements of the paper if we find it out.
Lovely. Any more questions from everyone?
No question is a stupid question.
Yeah. Feel free to ask any questions that you want to ask. I'm still waiting for people to type the questions. I've sent all the link on the chat as well if you want to find more information about Born in Bradford, BiB4All, Baby Network, ARC, and the feedback form as well. So there's one question it's anonymous. She's pregnant. I'm pregnant but in Leeds, hoping to be part of the baby Leeds. Can I take part in the study or is it only those with baby Bradford?
So thanks so much for your question, and thanks for being keen. That's really great to hear. Thank you. So we will. So there's two types of the study. There's the baby overall research linkage, and then there's the more in detailed bloods and swabs. So for the bloods and swabs, you won't be able to take part. Because that's just Bradford and Wakefield. But for the wider network, if you're joining BaBi, then that's great. And we've got an agreement with Leeds and the other BaBi sites, and we will all share pooled data together, and then we'll use the records from your child, and we'll see if the vaccine is working using clinical records. So you're very welcome to be part of it, and please do join the BaBi Leeds site. And by doing that, you'll be part of this RSV work, but you can't join the blood test immunological bit of it. But thanks for being interested. Divine's on mute.
Sorry. Any more questions, everyone? I think maybe it's still typing. Dr. Brett, could you tell us again when the RSV studies will roll out?
Yeah, absolutely. So we're hoping to start recruiting at the end of this month for the in detailed immune study. And we've already opened, so the BaBi overall data linkage study is already open. So if you are pregnant, you'll be offered the chance to join BaBi, and they'll ask if they have your permission to link with your routine healthcare records and if you are, then have a think about it, but we'd encourage you to do so. And then that's already running now, essentially. So yeah, if you're pregnant and you haven't been asked already, then we'd encourage you to join. But have a read, have a think, see what you think.
Amazing. Thank you. So any more questions? Last call. Oh, there you go. Questions in the chat. Is there a link with slightly increased risk of premature birth and RSV?
Yeah, so Zoe, do you mind just clarifying if you mean the vaccine or the infection?
Okay, so let me allow her to talk. Zoe, you can talk, if you don't mind. She's just vaccine. She
Vaccine.
said vaccine.
Yeah, so good question. There's a long answer and a short answer. The short answer is no. The long answer is that if you look at, so there's another vaccine called the GSK vaccine. They tried to develop one, and that did have an increased risk of prematurity. And so there was some worry about whether that could happen for this vaccine. And so if you look at the data, there is a slightly higher number of births born prematurely in the vaccine group than in the unvaccinated group. In low-income countries, specifically in South Africa, but that is not statistically significant, and it's certainly not a difference that we've seen in high-income countries. And we also think that there is a risk of premature birth from getting RSV infection. So I think the short answer, the simplest answer is if you're in a high-income country and you're having the Pfizer RSV vaccine, then no. And the GSK vaccine was not rolled out for that exact reason.
She added USA study. So is that?
I'm not sure the study you mean. Great. Sorry. I'm not sure of the USA study, but I'm not sure the one you mean. Sorry, but the Campman trial is the one that I presented earlier, and they've got really good accessible data both in the main study and in their appendixes around the prematurity question. Yeah, I think the answer is they're a slightly higher proportion, but not statistically significant. And if you ran the trial 100 times, you might see it the other way around. It wasn't enough to be considered significant. So it's a safe vaccine, and it doesn't cause prematurity. I hope that answers your question.
Okay, thank you. Any more questions? She said yes, so we said yes that you answered the question. Lovely. Thank you, Zoe.
But as with all these things, it's always worth talking about that you have these phase 4 trials where you look at what's happening in the real world after it's been rolled out. And so there's lots of work going on in America and in the UK MHRA, and so far they haven't found any concerns in the real world about an increased risk of prematurity. And I think that's more important than a kind of in the real world, it's probably the most important area. So.
Any more questions? Any more questions? You can type it on the chat if you want to, or the Q&A. I'll check both of them.
Well, it looks like there's no more questions, but do feel free to email me if you're keen. Very happy to chat about RSV. It's my favorite topic and how we can prevent it. So thank you so much for joining today. Divine, thanks for all the support and making it happen. And it's a real pleasure. So thanks again. Thanks for coming.
Thank you. Thank you. Thank you, everyone.
I'll hang around for a few minutes in case anyone wants to talk afterwards.
I'll say thank you. Great presentation.
Rachel's asking about recording. Yeah, it's going to go on YouTube, isn't it? Is that right? Yeah.
Yes.
So Divine will, I don't know, how do they access? I guess they can just Google it, but
No,
we can circulate it to all attendees that signed up, I guess.
Yes.
Yeah.
I will post email to everyone who will attendees who can't attend. As long as their email address is on the ticket source, they'll receive a link. Thank you.
And feel free to share it as well. So if you've
Yes,
got friends that couldn't sign up at all, just feel free to forward the email as well. Great. So it looks like that's probably the end of it. Thanks so much, Divine.
Thank you, Dr.
Can
Rod.
sign
It's
off now.
very
Great to
helpful.
see you. Yeah,
Thank you so
we'll
much.
be in
And
touch soon.
thank you. Bye.
Thanks. Thanks, everyone.